Chapter 6, Treatment of Depression. We'll skip over the key terms because we will review them in the chapter. It is estimated that more than 15 million Americans experience a major depressive episode annually. Depressive disorder may be precipitated by hormonal changes such as premenstrual syndrome, pregnancy, or postpartum, substance abuse like alcohol and other drugs, or illnesses such as Parkinson's disease, heart attack, or thyroid dysfunction. Heredity plays a role as well, particularly in bipolar disorder, because children born to a parent with bipolar disorder are at increased risk for the illness. Depressive illness influences most aspects of a person's life and lifestyle. It affects self-esteem, moods, thoughts, eating, and sleeping. Depression reduces the ability to think and concentrate. Feelings of worthlessness or guilt often accompany depressive episodes. As many as 12% of depressed patients contemplate or attempt suicide. Without treatment, symptoms of depression can persist for a few weeks to years. The three primary types of depressive disorders are major depression, bipolar disorder, and dysthymia. Major depression is also called clinical depression and is associated with persistent feelings of sadness, emptiness, or hopelessness. These feelings persist for several weeks and are usually accompanied by a lack of interest in activities that were previously thought to be enjoyable. Fatigue, irritability, and insomnia or hypersomnia. Sometimes the depression manifests itself in other physical ailments for which no treatments are able to cure or reduce symptoms. Bipolar disorder, formerly called manic depressive order, is associated with sudden swings in moods between depressions and periods of mania. Mania is associated with hyperactivity, racing thoughts, insomnia, distractibility, and increased goal-directed behavior. Manic periods can last for 1 or more weeks, during which time the person may sleep little and produce a prolific amount of work. Several well-known people, such as Vincent van Gogh, are believed to have had bipolar disorder. Dysthymia produces symptoms that are similar to those of major depression. However, the symptoms are less severe. People diagnosed with dysthymia have symptoms that are chronic and, although not typically debilitating, keep the person from functioning well and feeling good. The causes of depression are not completely known at this time, but a deficiency of certain neurotransmitters is involved. This explains why people with depression cannot just pull themselves together to get better. Drug treatment is aimed at restoring depleted neurotransmitters to normal levels. According to the biogenic amine theory, major depression results from a decrease in monoamine neurotransmitters in the brain. This hypothesis was made upon the discovery that patients treated with drugs that deplete monoamine neurotransmitter stores in the neuron develop depression. Neurotransmitter binding sites are also less sensitive in depressed persons. The neurotransmitter norepinephrine plays an important role in the treatment of depression. It is widely distributed in the brain and in the periphery. Decreased levels in the brain are responsible for depression, and increased levels in the periphery can cause serious effects such as hypertension. Serotonin plays an important role in the treatment of depression. 5-HT is an excitatory neurotransmitter. More than 9 5-HT receptors have been identified. 5-HT receptors that have been well studied are the 5-HT1A, 2A, 2C, and 3. Drugs that antagonize 2A, 2C receptors are used in the treatment of depression and negative symptom schizophrenia. Drugs that antagonize 5-HT3 receptors are used to treat nausea. In addition to improve mood, 5-HT is involved in regulation of the sleep-wake cycle and pain perception. There are 5 types of dopamine receptors. Binding to D2, D3, and D4 receptors is inhibitory, and binding to D1 and D5 is excitatory. DA binding plays less of a role in the treatment and management of depression compared with neurotransmitters, norepinephrine, and 5-HT. Drugs that are used in the treatment of Parkinson's disease and schizophrenia potentiate the activity of DA. Some drug classes that are used in the treatment of depression. One of them is tricyclic antidepressants, which we abbreviate as TCAs. They're the oldest class of medication used in the treatment of depression. The effectiveness of newer agents is compared with that of TCAs. They are used in the treatment and management of several medical conditions in addition to depression. They are also prescribed for neurosis, commonly known as bedwetting, such as imipramine and nortriptyline. They are prescribed for the treatment of obsessive compulsive disorder, clompramine, and as adjunct drug therapy in the management of chronic pain, such as amitriptyline and nortriptyline. And doxepin is prescribed for sleep disorders in lower doses than used for depression. In depression, sufficient neurotransmitters may be released into the synaptic cleft. However, the neurotransmitters may be returned to the neuron before binding occurs. The TCAs are readily absorbed when administered orally. They are lipophilic, so they're widely distributed within the central nervous system. The onset of action, duration of action, and half-life vary among agents. The half-life of the TCAs can be as short as 4 hours, like imiprine, and as long as 96 hours, like nortriptyline. Their long half-lives are associated with their high degree of lipid solubility. The long duration of action of these agents permits once daily dosing. The TCAs are metabolized by macromazole enzymes in the liver. Several of the TCAs are metabolized to active metabolites. Amitriptyline is metabolized to nortriptyline, and desipramine is a metabolite of imipramine. They are ultimately eliminated in the urine. Although the onset of action may be relatively short, maximum benefit can take up to 6 weeks to be achieved. Dry mouth is a side effect of TCAs. It can be relieved by sucking on sugarless candy, and it can also increase cravings for sweets. There is a lot of medications that cause dry mouth, and instead of sucking on sugarless candy, I would recommend getting like biotin lozenges that have xylitol in them. They're also sugar-free, that are made to treat that versus just sticking candy in your mouth and hoping you're gonna help yourself. And of course, you as a technician would never recommend that, but the pharmacist probably would. They all have a similar structure, so the side effects of the drugs are similar. What varies is the degree to which a particular TCA will produce the side effect. So, for example, all TCAs produce sedations, but some, such as amitriptyline, have high sedative activities, while others, like desparamine, have low sedative activity. Hypotension and reflex tachycardia is caused by postsynetic adrenergic blockage. Sedation, weight gain, and hypotension are produced by histaminic receptor blockade. Blockade of cholinergic receptors can lead to blurred vision, dry mouth, constipation, urinary retention, confusion, and delirium. They can also produce photosensitivity. Prescriptions for small quantities of the TCAs can be written for depressed patients who are believed to be suicidal. Hypotension produced by the TCAs is a problem for elderly adults because they are at risk for fainting or falling. The TCAs have a narrow therapeutic index and can produce cardiotoxicity at doses that are 6 to 8 times higher than the therapeutic dose. They should not be discontinued abruptly. Patients should be gradually weaned from the drug. Tricyclic antidepressants, which we've talked a lot about, amitriptyline in this chapter. They are available as Elavil, even though this is the Canadian, should be here. The tablets are 10, 25, 50, 75, 100, and 150. So it comes in a bunch of different strengths for oral tablets. Desparamine is available in 10, 25, 50, 75, 100, and 150 as well. Same with doxepin, but doxepin is also a oral solution concentrate. It's also available as a tablet and as a cream. Imipramine, tofranilil comes as capsules, which are pamuate in tablets, hydrochloride. Nortriptyline comes in 10, 25, 50, and 75 milligrams. It also comes in a 10 milligram per 5 ml solution. Escitalopram, fluoxetine, fluvoxamine, paroxetine, sertraline, vilazodone, and vortioxetine are selective serotonin reuptake inhibitors. They're the most widely prescribed antidepressants. They're categorized by their MOAs rather than their chemical structure. They're used in treating obsessive compulsive disorder, premenstrual dysphoric disorder, and panic disorder. Fluoxetine is also indicated for treatment of anorexia and bulimia. Bupropion, mirtazapine, nefazodone, trazodone, Trintellix, they're all atypical antidepressants. In addition to depression, bupropion is used to treat seasonal affective disorder and smoking cessation. Contrave is a combination drug containing bupropion and naltrexone that is used to treat obesity. Rexulti, a newer medication, is used in the treatment of major depressive disorder and schizophrenia. The contents of Effexor XR, which belongs to the SNRIs, those can be sprinkled on food, so that should probably be up there, but we'll just want to get that in there. So for atypical antidepressants, although they're well tolerated, doses of bupropion that are greater than 450 milligrams a day or 150 milligrams per dose increase the risk for seizures in people with seizure disorders. Mirtazapine may cause drowsiness or dizziness, dry mouth, constipation, blurred vision, diabetes, and suicide ideation. Nefazodone and trazodone produce low to moderate sedation, but they may negatively affect cardiac stimulation. Side effects of trazodone are sedation, hypotension, nausea, and priapism, which is a painful, persistent erection. The most common side effects of Trintellix is nausea. It may also produce serotonin syndrome, hyperflexes, nausea, vomiting, sedation, dizziness, sweating, facial flush, restlessness, shivering, and elevated blood pressure. For bupropion, we have several different brand names here, several different dosage strengths, tablets and 75 and 100 milligrams, extended release tablets like Wellbutrin XL and Forvivo XL, sustained release 12-hour tablets like Wellbutrin SR. Mirtazapine comes in orally disintegrating tablets as well. And trazodone comes in 50, 75, 100, 150, and 300 milligrams. Mood stabilizers are used in the treatment of bipolar disorder. Lithium is the oldest of these agents, introduced more than 50 years ago. Medications used in the treatment of seizures have been discovered to effectively treat bipolar disorder. Lithium is administered to reduce current symptoms of mania and depression, as well as to prevent recurrence of future episodes. Lithium is rapidly absorbed from the GI tract, which accounts for its rapid onset of action. The drug has a half-life of 24 hours, which increases the longer the patient is on lithium therapy. The half-life can double over the course of 1 year's continuous therapy. Lithium is not metabolized and it is not eliminated, or it is eliminated unchanged in the urine. Lithium has a narrow therapeutic index. A competitive interaction may occur between lithium and sodium in the kidneys that can result in lithium toxicity. Increased sodium intake can decrease lithium reabsorption. Dehydration can increase lithium reabsorption. Plasma lithium levels and renal function should be monitored regularly to avoid the development of lithium toxicity. Valproic acid, carbamazepine, and lamotrigine are anti-seizure drugs with demonstrated efficiency in the treatment of bipolar disorder. They are indicated as an adjunct to lithium therapy or when lithium administration has not produced desired results. Lamotrigine is used in the treatment of bipolar disorder, seizures, and has some serious side effects. The use of valproic acid, carbamazepine, and lamotrigine are used in the treatment of seizure disorders, which we will later discuss. Drugs used in the treatment of bipolar disorder. Lithobid is our lithium carbonate, lithium citrate. Comes in capsules. 150, 300, 600 comes as a syrup. Comes in tablets and also comes in extended release tablets. Depakote and Depakote ER. Carbamazepine, which has several different brand names, Carbatrol, Tegretol, Tegretol XR, and lamotrigine, which is Lamictal, Lamictal CD, Lamictal ODT, and Lamictal SR, XR. Now we have the summary of drugs used in the treatment of depression, which we've kind of already went over throughout the chapter, but this table lists the usual oral dose and dosing schedule, and also list some more side effects, which we've talked about a lot of them. But interesting, we didn't talk about the fact that amitriptyline can cause the urine to change to a blue-greenish color. SRIs, we've already talked about those and their side effects. Same with MAOIs, SNRIs, and atypical antidepressants. Drugs used in the treatment of bipolar disorder. They can cause dizziness or drowsiness, can impair your ability to drive. You should avoid alcohol, take with food. When you're taking lithium, you should drink plenty of water. Swallow whole, do not crush or chew controlled or slow release tablets. Pregnancy should be avoided with lithium, carbamazepine, and divalproex. And of course, do not discontinue without medical supervision.